Commissioner Califf, and Assistant Secretary O'Connell, thank you all for being here today. We all look forward to your testimony, and with that, we will begin with Dr. Walensky.
Chair Murray, Ranking Member Burr, and members of the committee, I appreciate the opportunity to discuss monkeypox and CDC's response to this global outbreak. To date, there have been over 59,000 cases of monkeypox reported globally, including over 22,000 cases and 1 confirmed death in the United States. In the current outbreak, the first cases were diagnosed in the United Kingdom on May 14th, and within days, additional countries began identifying case clusters. On May 17th, a case was reported in Massachusetts and was confirmed by CDC the following day. CDC immediately began its work, searching for additional cases, educating clinicians and the public about this disease, and supporting our state and local public health partners in their response. In less than 1 week, CDC reached out to commercial labs to increase testing capacity and began to scale up an incident response. Over the last several weeks, we've been pleased to see a decline in the growth of new cases here and abroad, though there are areas in the United States where the rate of rise in new cases is still increasing. We approach this news with cautious optimism, recognizing that we must continue to aggressively respond to with our entire toolkit, including vaccination, testing, and education about risk to inform behavior change. This outbreak has been notable for transmission primarily, but not exclusively, through sexual contact. It has disproportionately affected gay, bisexual, and other men who have sex with men, with a large majority of cases in this population. CDC has been studying monkeypox for decades and has contributed to the creation of the test, experimental therapeutics, and vaccines that are available today. But as a relatively rare disease, almost no providers in the U.S. have seen or even heard of monkeypox. Provider education has been a key component, indeed a remarkable challenge, but critical to our response. CDC has issued 4 health advisories, each reaching over 1 million people, and host clinician outreach calls joined by tens of thousands of clinicians. We've also shared monkeypox information for congregate living and K-12 schools to prevent monkeypox spread in these settings. Initially, our public health laboratory response network labs across the country were able to collectively test up to 6,000 clinical specimens each week using a diagnostic test developed to detect orthopox viruses, including monkeypox. CDC worked with our public health partners to quickly expand testing capacity and engage commercial laboratories to increase capacity to 80,000 tests per week. While weekly testing volume is currently 14% of total testing capacity, we are working with academic medical centers, commercial and public health laboratories to make testing even more accessible to all who need it. From the beginning of this response, CDC has worked closely with ASPR to make Jynneos vaccine available to based on their case numbers and underlying population at increased risk. Based on data from 39 jurisdictions reporting to CDC, a total of over 540,000 Jynneos vaccine doses have been administered. Collaboration with communities most affected by the outbreak, including the LGBTQ+ community, is critical to our response. We rely on our partners across public health and LGBTQ+ advocates and community-based organizations to contribute to their expertise to our response, to challenge us to continue to do better, and to amplify our public health messages. In recent weeks, CDC has provided technical assistance and support for vaccination efforts and other monkeypox response activities at large events serving LGBTQ+ audiences like Charlotte Pride and Atlanta Black Gay Pride weekend. These efforts and others have facilitated delivery of vaccines to those who may face unique barriers to access, including racial, ethnic, and geographically diverse populations. The robust response required for public health threats like monkeypox underscores the importance of sustained investments in the core capabilities that should constitute the foundation of a 21st century public health system. In addition, CDC needs additional policy levers to enable the timely reporting of data necessary to take the informed action the public expects of us. Despite having a vaccine distribution strategy since June 28th, it took until early September to complete all 61 data use agreements needed to receive vaccine administration data. While we work to control this outbreak in the United States, we anticipate that monkeypox will continue to be a global threat. Once this outbreak is controlled, we will need to maintain vigilance, education, and vaccination efforts so that another outbreak does not emerge. That is why now it's important for Congress to act upon the supplemental request. CDC will use the additional resources to support testing and laboratory capacity expansion, vaccination efforts, surveillance, epidemiologic investigations, outreach, education, and global efforts. Together, we can meet the fast-evolving threat of monkeypox, successfully end the current outbreak, and prepare for any future outbreaks. Thank you. I look forward to your questions.
Thank you. Dr. Fauci?
Madam Chair, Ranking Member Burr, members of the committee,